Good morning, good afternoon, good evening. My name is Arja Rautio and I'm coming from the University of Oulu, Finland. I'm a professor in Arctic research and I'm also a vice president of research of the University of Arctic. I'm working in Thule Institute, which is taking care of and coordinates the Arctic research in the university. And very much thank you for inviting me to participate in this excellent course and giving this lecture about COVID-19 in the Arctic regions. So that today the topics of the talk, of course, it's Arctic population, but I also want to introduce you the One Health approach, and of course talking about the COVID-19 pandemic. And some words about the University of Oulu, so that it's around 13,000 students and a little bit less than 3,000 staff members. And it's situated in the middle of the Finland, 150 kilometers south from Arctic Circle. And these photos you can see, this is the place where I was born in Rovaniemi region, and it's a midsummer eve in this picture, and it's something, one part of my soul is there. The second one, there is a research team with whom I'm working very closely. They are Antti Oksanen, veteran, and Khaled Abbas, who is a toxicologist, and Anastasia Emelianova, who is taking more about the demographic changes. And there's missing Ulla Timlin, who is focusing on the mental health and mental wellness, quality of life research in a project of Nunataruk. And the last one is the outside photo of our institute. I'm a medical doctor in my training, and I have been working in the multidisciplinary research, I think that whole of my career in the university. And now I have been during the last 3 years being a vice president of research in the University of Arctic. And you can see the map, and those yellow spots or circles, they are all those institutes and colleges and universities which are members of the University of Arctic. They are now more than 200. Most of the universities and education and research institutes, colleges, they are from Arctic countries, but we have also non-Arctic members. And those logos about the Sustainable Development Working Group and Arctic Council, it shows that I'm also a member of 2 health groups in the Arctic Council, so that in the Sustainable Development Working Group, and another is from the Arctic Assessment Program with the Contaminants, AMAP. And then something about the Arctic population, so that depending about the borders of the Arctic, we can say that they are living around from 4 million to 10 million inhabitants, and around 10% of those are indigenous. And this map, it's made by Nuregio, and it's the Arctic region is defined as the Arctic Human Development Report. It shows. And you can see very clearly that half of the Arctic is Russia. And also that 2/3 of the population which is living in Russia. And when we are thinking about the health and well-being aspects, they are not equal in the all part of the Arctic. So that it's different in the different territories and regions. And if we are measuring them like life expectancy, infant mortality and diseases, or access to the healthcare services. And in many cases, the indigenous peoples, they are having a poorer health, and they are also the condition of the living conditions and access to the healthcare services is poorer than those non-indigenous ones. And of course, this causes the differences in the indigenous and non-indigenous peoples, and if they are living also in the same region, and it's also differences in health and well-being, living in the rural or urban areas, and between the south and north of the same country, or even in territory. And all these facts, they are the basic elements for the strategic planning for any climate, environment, or other hazards. And also it's important points when we are talking about food and water security. And in this case, the pandemic or any zoonotic, emerging zoonotic diseases which is coming up. Because these things, they don't recognize any borders of the countries or any other. And also it gives the things that when we have so large area with the different types of the situations, we need also the local level, which has own plans and strategic issues, what to do, how to take care of the population of the region, and how to support the good quality of living. And then I want to introduce you One Health approach and why it's so important. You can see in this figure that it is from the University of Alaska Fairbanks, and they have started now very nice master's program focusing on the One Health, and so that they are very interesting courses. But in this One Health approach, it means that the human health is very closely connected to the animal health and environmental health, so that the ability for the resilience and adaptation, and also the individual and community well-being, is depending on the surrounding environment and also animals' health, so that the food safety, healthy wildlife population is one of the important elements of the human health. And of course, we need the clean air, water, and plant-based food, so that all this is connected. And of course, this has been all the time, it's an indigenous view of the health is like that. And now it has been introduced more and more also to the science and also the non-indigenous way of thinking. And I think that holistic view is really important when we want to know what is happening in the Arctic. We need the multidisciplinary different levels actors to see what is happening in the circumpolar Arctic. We need the co-production of the knowledge. And of course, now, even thinking that now when the pandemic is so quickly spreading all over the globe, we see that there are tight connections to the rest of the world. Arctic is not the island. One Health also includes the community-based participatory approach, and it's also focusing on the ethics guidelines. And I think that by using this One Health approach, it gives us tools for better communication and better collaboration between the people in research, education, policymakers, stakeholders, and local and indigenous peoples. Then thinking about the COVID-19 in the Arctic. And this is the 5th pandemic which has been happening during the last 100 years. But I'm definitely sure that the next 100 years we will have more pandemic than these 5, only 5. We need to prepare for that kind of occasions. And it has been very active role of the Arctic Council, so that the Sustainable Development Working Group, which is one of those six working groups in the Arctic Council, took the lead and make a report of the COVID-19 in the Arctic. It was published in the summer, and now it has been plans to go forward, so that there would be a project which would be focused on every eight Arctic countries, and looking what has been happening during the first year of this pandemic, how the communities have been surviving, what are the problems, are there more economical ones, are there health problems, what are the things it should be focusing in the future. There have been a lot of seminars and workshops about the COVID-19 in the Arctic, and one is Arctic Resilience Forum session on human health and pandemics. It was in a connection of the Arctic Council meeting. They have published a lot of publications. In the next slide, there is some of the list. I have listed some of those, and many of those, they are also coming from the indigenous communities and populations and organizations. The one which I'm now talking about more, it's Andrei Petrov's and co-workers' article about the spatiotemporal dynamics of the COVID-19 pandemic in the Arctic. It's early data and emerging trends. And it has been published in the International Journal of Circumpolar Health, and you can see the link, just the next line. And the last line is the information where Andrei and others, they were collecting this data. It is active link and it's updated every day. And you can very easily see what is the situation of the COVID-19 and all the cases in different territories and regions in the Arctic. I have took one of the figure of this publication. It's giving all the Arctic countries and the Arctic part of those countries, and it's showing what kind of things there have been happening during the February, starting from February last year and ending in 1st of July in the cases of the new infectious. And you can see that they are the different type of the actions. You need to you need to find that the scales, they are different, so that if you are looking the numbers here, you can see that, for example, comparing Greenland and Sweden, the scales are totally different, and it also shows that in the Arctic there are two countries which have had not so many cases of the COVID-19, and they are Greenland and Canada, Northern Canada. And they are now marked as green. And as yellow, there are Faroe Islands, there are Iceland, Northern Norway, and Northern Finland. And they have very high peak coming to new cases in the springtime. And they have a very quick quarantine and strict orders to the population. And also the cases, they went down very quickly. In the case of the Alaska and Northern Sweden is so that they have no restrictions and quarantine so much as the others, and they have much more cases also in the Arctic. And in Russia cases, so that the pandemic was starting later, and it was coming by the fly-in, fly-out workers in the oil industry or in mining. And it's very worse at this moment. And it can be said that the infections are higher in the Arctic Russia than in the whole country in general, at least the first 6 months of the pandemic. And the other countries, they are lower levels in the north than in the south. Here is, I promised these publications, and you can find them from these websites. And I think that those are really interesting to read, how the Arctic regions, they are differing from each other, and how the local communities and indigenous people are figuring the most important challenges during the COVID-19. And the map is also from Nordregio, and it shows that the red ones, they are the roads. The red lines, they are roads. And in many cases, the pandemic, they are just they are spreading by the roads, and also in the case of the Arctic, by airports, where the people are moving and traveling. Then I want to introduce you One Arctic, One Health project. It started almost 6 years ago in the chairmanship of United States. It was started first US and Canada. In the second 2 years, there were also Finland with, and now we have Norway and Greenland also involved. And this is the project of the Sustainable Development Working Group, and it's continuing, I hope, that also in the Russian chairmanship period. And it's very successful, especially at this time when we very nicely recognize that COVID-19 is zoonotic diseases. We got that from wildlife, we got that from animals, and that is the issue we should also focus in the future. So that these diseases, zoonotic diseases, they don't recognize the borders of the countries. So that we need to have the exercises where the neighboring countries, officials, the people, they are talking with each other how they would arrange the things if that kind of disease is coming from one country to another by the new species or of the animals or vectors. We have had joint meetings and sessions. We have also published scientific articles. We had a very nice tour in Alaska to have visiting the places where this kind of monitoring is happening. And also we all learned that the local environmental observation system is essential to have the local people and indigenous people information what is happening in the environment and what are the challenges of the climate change. We have established an animal health network, TREM Arctic, which is a liver fluke in fish, and it's led by Antti Oksanen. We have also arranged one health conference in Oulu, and the next one is coming in April, and it is arranged by University Alaska Fairbanks. And there will be a new project introduced very soon to the Arctic Council and Sustainable Development Working Group, and it's led by and suggested by Russia, and Finland is also participating. And it is focusing on the migration of the wildlife, especially birds, but also the permafrost thaw. And covering in permafrost, there is, for example, a lot of contaminants, especially mercury, and so that, and also the anthrax is believed to stay very long time, and maybe many other infective agents. And that's why I really hope good luck for the new project, and hoping that it will start very soon. And now how we can ensure that we have safe and good quality of life in the Arctic. It is a very important question, and it's not solved by one group or one sector of the science or whatever. One important issue is so that we can cover the whole sectors together. And actually this old figure, which I was made by Erkki Alasaarela 2008, it means that for the human being it's so important that we have clean food, clean drinking water, and clean air, so that we are surrounded by the viruses and bacteria, chemicals, but very strong connection to the animals, wildlife, and domestic ones, plants, and also the whole society, having politics, industries, and economy together. And that's why I think that we can do this collaboration in many levels, so that in the Arctic Council, different working groups, having joint projects, having perhaps tabletop exercises, and also the collaboration between Arctic networks, University of Arctic, International Arctic Social Science Association, International Arctic Science Committee, and also those different conferences and workshops with those organizations are arranging. One of the important actors in the COVID-19 is the International Union of Circumpolar Health, which also arranges conferences. And next one will be in next year in Russia. Collaboration between the research, education and regional projects, so that European Union has been focusing very much about the polar projects and also including the local and indigenous people. And I hope that more and more also indigenous knowledge and traditional knowledge to those big projects. And there are also the Nordic Council of Ministers very urgent project of climate change effects on zoonotic diseases in northern societies. I think that we have a lot of information also from these research projects. We need to have this One Arctic, One Health conferences also in the future. And please, there are 2 articles. There are Callahan et al. They have published a paper last year. It's improving dialogue among researchers, local and indigenous peoples and decision makers to address issues for climate change in the North. And another one, which is very recent, they are the ethical considerations for community-based participatory research with Sami communities in North Finland. So I hope that these are some of the ideas for the future work, and also how to have the place in the table when discussing about the safe and good quality of life in the Arctic. And I really hope that you could participate the next University of Arctic conference. We have planned to have that in May. It will be online or hybrid, or what is the situation depending on the COVID-19. But welcome to participate. And this is my last slide. I really want to say thanks to my collaborators and helping me to prepare this presentation, and thank you very much for your attention.